Hi everyone, this is Ginger. I wanted to give you a quick update because I haven't done that in a few days. Today is day 15 and I still have the drain. I wanted to point out a few things for all you ladies who are going through this out there, because it can be a scary thing to wake up and realize that your arm is filling up with fluid, under your arm or anywhere around that area. That's happened to me several days in a row. Now I have had to go back to the doctor because I couldn't clear it myself twice, maybe 3 times, I can't remember now. But I've also had to clear it with the help of family members multiple times, sometimes 2 to 3 times a day. The reason is, if it's not a drain put in the OR, it's going to be one of these. See how small that catheter is? That just goes right up into an area that's stitched in. That's thin, which means any bloody, soft tissue kind of shedding that happens internally comes out and through that drain, and it gets clogged very easily. What I have learned is that the catheter is quite elastic. So I'll show you just the top of this. It's very elastic. I have to be careful how much I'm using my arm because it stings and burns quite a bit. And I don't want to dislodge the catheter from the seroma cavity. But you can stretch this. I don't usually do it myself because of the limitations on my arm, but I will have someone else do that. They'll stretch it, and it does break that mess up. And it usually goes on through. So that's a little bit of information there. You can also, manually, to just check and see if that drain is flowing, manually work some of that down into the drain. You may also want to add a Jovi pack or some similar compression garment, which I'm wearing now, underneath a compression top. So a lot of layers going on here. It's a good thing it's fall and not summer. So my empathy goes out to you if you are experiencing this in the summer. We're having a warm streak now, and it is hard to find stuff to wear, for sure. The other thing that I wanted to point out at day 15 is sleep is not really much easier than it was immediately post-op. And I'm feeling for you there, because sleep is so important. We cannot heal and recover if we're not sleeping. So I have figured out a few things. Now, as a physical therapist, I'm constantly teaching positioning for sleep. I have been through multiple abdominal surgeries. I have been through hip arthroscopy. I know what it's like to be in excruciating pain and trying to sleep at night. And I am not a big pain med person. I haven't taken anything in a while, over a week, probably. Not keeping track, but I stopped taking stuff very early on. It does mean I have a little bit more discomfort in this area, but I can tolerate it. That means when I go to sleep at night, I need to be more proactive, right? Than if I was just taking something to help with that. So having a quiet, dark room. I have an air cleaner also to keep the air clear, so I have less allergies. Coughing and sneezing, that's gonna hurt too, and could dislodge things. So an air cleaner, room, darkened room, quiet and cool. Turn your AC down at night so that you can sleep. Increased core temperature does not allow you to fall asleep. Also, if you need to wear blue blocking glasses, I will turn the amber light on my phone if I have to be on my phone, if I have to be on my computer, to cut down on the chances that melatonin won't be produced. I do have a sleep blog as well. Go to integrativlifestylemed.com and just search sleep, and you'll get a sleep blog. There's a handout. There's a bunch of research to back it up. There's a downloadable printable that you can smack on your fridge or something with all the tips on good sleep. I've added 1 to 2 milligrams of melatonin at night, an hour or so before bedtime. Talk to your doc about that. I have added, as I usually do, magnesium to my nighttime routine. You need to talk to your doc about what magnesium may work best for you, because a lot of people are deficient in magnesium and you just can't rest well without it. It's also great for digestion, as I mentioned early, but that's different types of magnesium. So make sure you do your homework on magnesium. Don't just take anything. I also prefer a powder magnesium that I can drink rather than one that has to dissolve and take longer, to get, taken out by my system. So those are some of the same things that I use to help sleep. You can also take and eat melatonin producing foods as well. I believe I include that in my blog too. But those are easy to look up online. Positioning. I mentioned positioning being the most important. I can't sleep on this side. I can't even partially sleep on this side. So it's either back sleeping. You can look up yoga couch. Just Google my name and yoga couch. And there's a video on how to set it up. I want you to set up a wide one, like an extra wide load yoga couch, right? Because you're gonna sleep on your back with your affected arm supported in a neutral position, which is about like this, okay? At night, I do try to maximally, okay, this is as much as I'll bring my arm up, rest it on that yoga couch, because the pectoralis is so locked down right now. My shoulder is too far forward. It won't rest flat. You may notice that. This one, you may notice on yourself, this one rests flat on the bed. This one does not. My shoulder's never been this way before, okay, that far forward. I can't just physically push it back right now because I can't do soft tissue work yet. But that's why physical therapy is important. When you do get your drain out and you're able to get therapy, go get it. If you have not been referred for that, ask for it. There's so much that a PT can do to help you, including doing manual lymphatic drainage as well. So I do support my arm with a blanket, just yay forward like this. That does not pinch and pull and burn and sting. My arm is actually getting a little bit of therapy because it's resting that pectoralis that's so darn tight overnight. And I can't stay there all night, right? You can't stay on your back like that all night. I wish you could. So when I do have to move, I have to support myself, bring it all over. I have one pillow to support me here, okay? Have one pillow to support between my knees, because that's necessary. I have a wall of pillows. Okay, one here, one between the knees, and another one, a third one, where I can bring this arm up again in neutral and keep it off of my chest wall. Because right now, when I try to bring my arm remotely near my chest wall, there's too much pain. And that may be something you experience. So in that case, imagine I am laying on my right side, pillow between the knees, pillow like between the girls here, okay? Because you can't let all this just fall. It's too painful. So pillow supporting here. Another pillow that's higher that will not let your shoulder fall past this point, right? Don't let your arm fall past this point because it's gonna squash everything. You're probably gonna wake yourself up in pain. When I support my arm like that, with pillow here, and pillow there for the hip, I can't raise my arm for that long. That starts getting me. I can sleep better, not perfect, but for several hours stretch at a time. So see if some of those sleep tips help. Continue to watch out for any clogs in your drain that you may have at this point. Like I said, I'm at day 15. There's currently no end to this drainage stopping. It's continuing to come out, continuing to get clogged. I'm continuing to work on it and just stay proactive. It might be up to 3 weeks before I see that the drain is able to come out, because I didn't get the drain until day 10. So it's gonna be a while. And meanwhile, all the physical therapy needs I have are just kind of stacking up because I can't do a whole lot at this point. I hope that has been some help to you. It's been honestly a pretty frustrating couple of days because things haven't gone as I thought that they would, but I have to be patient with myself. So I'm encouraging you to do the same. If you hear strange noises in the background, that would be my husband trying to learn the cello. Apologies. I bought him that for his birthday. lessons. So my deepest namaste to you. Practice your deep breathing, your ujjayi, to keep your lungs clear. And please reach out with any questions that you have. Despite the limitations you may feel, there's still a lot you can do to stay positive and to forward your progress. I'll see you next time.